Hello, Dr. Miaken of Monarch Family Chiropractic. Welcome to tonight's workshop. And tonight we're talking about pregnancy and chiropractic. And I think a lot of people might think that this is a topic that is very specialized and specific maybe to mom or to a woman who is considering getting pregnant, having a family. What I want you to think about when we're talking about pregnancy, we are really looking at when does the health of an individual start? And what we're finding out as far as looking at the study of epigenetics, which looks at how lifestyle impacts the genetic expression of an individual, we find that a baby's health starts at preconception. Actually, what is the health of mom and that egg, and what is the health of dad and that sperm? And we also see that the health of mom is vitally important in that 9 months of baby growth and development before they cross over Earth side. And so when we look at chiropractic in terms of how it relates to supporting pregnancy, we have to understand the bigger picture is how can we support mom to carry a baby full term and be in her best expression of health. We find that it's fascinating to look at some of the research out there related to moms pregnant experiencing massive trauma and stress, physical trauma, mental stress. They actually see the kiddos at 4 or 5 act out or verbatim share some of the language and conversation that happened while kiddo was in utero. And those are certainly some high stress, examples, but we know that if mom is healthy, that certainly supports the right type of trajectory that the kiddo can be when they start life, right? And so we're really looking at pregnancy in terms of how does chiropractic play a role, looking at how we can minimize the potential for a difficult labor or difficult birth. And then specifically, I'm looking at my points over here. I'm like, what were our points? Oh, specifically the Webster technique. And that's what chiropractors utilize to help support mom and what her body is going through. So let's get started here. So I already went through those points there. So chiropractic's role during pregnancy. Number one, it's to support having greater comfort through natural care. When you become pregnant, your body is no longer yours. There is a lot of hormonal shifts, a lot of structural changes that take place in order to support the growth of a living being. Okay, from like the teeny tiny, tiniest level you can imagine to a small pumpkin, right? So we want to support mom being able to handle those changes that take place, not only physically, but chemically in terms of what's happening hormonally and how they manage the demands of their world. If there are any pre-existing or unnoticed imbalances within the spine and pelvis, then that can lend to a more difficult and stressful pregnancy, because as the baby grows, if there's imbalances within the structure of the spine and pelvis, then that spine is growing in a malaligned state. And life is intelligent. So baby intelligently will shift their posturing to account for that imbalanced state, right? Which could have impacts on how labor goes, right? And I mean, 9 months may seem like a long time, but there is massive changes happening in a very short period of time, rapid growth happening. And so the body has to adapt. And the body is made to adapt, but we want to see normal adaptations. And when mom is healthy, when mom feels good, when mom is more imbalanced, baby feels good, right? And ultimately, we see when there are safer births, it's less intervention. And we know that when we start an intervention, it really turns into a cascade of events that take place. It's not just one, it's multiple, right? So that's really our goal of supporting mom and baby through pregnancy. And the beauty is, I mean, if you look at this bullet point here on the right, this last one, chiropractors can accomplish supporting better balance, supporting normal healthy adaptation, supporting a safer birth process without the use of medications, without having to harm the kiddo with introducing something synthetic or unnatural to the mom. And if anybody has, I mean, I think this was big on the news, but if Tylenol is used during pregnancy, they're seeing these kiddos are born and have ADHD, ADD, behavioral tendencies. I'll say later on in life, but they see it 4 or 5 years old if mom had Tylenol during pregnancy and used Tylenol on a regular basis. We've been told that Tylenol is safe to use during pregnancy, safe for baby, safe for mom. But what we're finding is that introduction of that chemical component to the body is actually impacting the neurodevelopment of this fetus, right? Of this baby. So comfort and support of mom and baby. Spine and pelvic stress. So your pelvis is, no one pelvis is the same. I mean, it's wide and it's elongated, and there's muscles and ligaments and tendons that attach along the spine and attach along the pelvis to help support the motion movement of the pelvis. Okay, so if there's any type of, again, if the starting point there is imbalances with how that spine is moving or how that pelvis is moving, you introduce a physical stress, because that's what pregnancy is, that is growing, then it is going to put more stress on that system. So we can see women who have sciatic pain that can, sometimes we see pubic pain, low back pain. I mean, those are typical signs and symptoms that we see with pregnant women, but it can be, I mean, our body is an ecosystem. So we can see all sorts of symptoms that won't necessarily be correlated with, the low back or the pelvis, but we can have mom who, they're being pulled forward. Now we're seeing more stress, more forward head posture, because that whole body, well, actually what we see is the body goes forward this way, and the body up here will overcorrect because there's so much here. And so we see a mom really going into distortion because of what's they're carrying through here. And again, typical weight gain during pregnancy, normal is considered 25 to 35 pounds. Sometimes we see larger swings than that. And a lot of it is here in front of the belly. So it just puts a lot more stress. When we're looking at chiropractic, looking at balancing the spine, balancing the pelvis, we call that adjustments. That can eliminate the causes of stress on the pelvis and the spine and maintain proper balance as the baby's growing. And I mean, I guess this obviously makes sense, but the uterus is enlarging to accommodate, right? And you've got these round ligaments that attach the uterus to the abdominal wall. So as baby gets bigger, those little ligaments that are just normally this size, they get this size and they're really ropey, right? And so they're really pulling to help support the uterus. And so again, sometimes if you have torque in your pelvis, one of those round ligaments could be here, one of those round ligaments could be here, right? So it really contributes to the asymmetry of imbalance to your structure. So the goal of the chiropractic adjustment and the Webster technique, which we'll get into, is how can we create balance, not only in the structure, but the tissue. So we have to look at bone, and we have to look at the soft tissue, like the ligaments and the muscles. So if the ligaments become torqued or twisted, you have an uneven pull happening on one side, which again, we look at how does the structure relate to the posturing and the positioning that baby takes on, right? So uterine tension, you can have tension on the uterus when you have ligaments that are torqued or twisted. And then that causes uneven pull on that uterus. And as we talked about, it restricts the baby's motion movement, and potentially hampers the optimal position that baby might take. And when you hamper that optimal position, it could potentially affect how they're developing. We can see that conditions like torticollis are start in utero. And so it can also prevent proper birth position. So if a baby takes on torticollis when you're stuck in a specific rotation, lateral flexion, you can't move. So a baby innately knows, I mean, it goes into a posturing and innately knows it's got to rotate through the canal. And when it rotates through the canal, you know, I mean, it rotates through, it gets the shoulders through and then comes out. So there's a rotation that happens as baby comes out. And then you've got gravity working, right? So natural labor is a mom either on all fours, a mom squatting, can be mom on a back. A lot of times we see women using or are in a bathtub or some type of water birth. You know, I did a home birth. I went from being on my back to being on all fours. I was standing. I mean, I was constantly moving depending on what was needed based on where my baby was in terms of the birth process goes. So again, if you look at traditional healthcare system and what happens in birth is you a lot of times see moms on backs. You know, moms are on their backs. Moms are given an epidural. And what happens when a mom is given epidural? They don't feel anything from here down. So they don't really understand when to push or the type or the way to push. The way to like pull, I mean, it's just a different type of push when you're birthing a child. And so, again, I can only base it on experience, and any pregnant lady will tell you, yeah, or who's had a child. But you really need to be connected to understand what's happening down here and what type of push and when the body's asking for a contraction. So if you have a mom on the back and they've been given an epidural where they're not feeling anything, they're disconnected to what's happening in their body and what the demands are for what's required for labor. And so again, I bring that up because our bodies were designed to give birth. A lot of times women are scared of birth, and it's understandable, but we've been giving birth since our existence. And so again, we're looking at, in the chiropractic lens, how can we support the most ideal structure and balance so that you are prepared to do the marathon of labor, right? And when you do that and your baby's coming out in a natural way, you're setting off a chain of events in terms of what's happening chemically and hormonally in their brain, what's happening in terms of lungs, what's happening in terms of their gut and flourishing their microbiome. So there's so many things that happen with a natural birth that are missed when we have a C-section. And if we have interventions that take place because there's abnormal stresses on, you know, the body and ultimately the baby, and you go through that, those interventions that take place, ultimately it oftentimes ends up in a C-section, right? So we want to minimize that happening. Okay, so there's something called dystocia, which is abnormal birth. This is the big thing that OBs are wanting to minimize. They don't want a difficult or an abnormal labor or difficult labor. When you have that, that's pain and exhaustion caused by long or difficult labor. Can lead to multiple medical interventions that can be physical and or emotionally traumatic for both mom and baby. Some of these interventions can carry high risk of injury to both. So Pitocin is introduced to create contractions within the uterus, okay? And it's Pitocin is, you know, immediate and massive contractions, okay? Epidurals, that's to give, you know, pain relief or I guess reduced pain sensation or sensation. Painful episiotomies, so that's when the vaginal opening is cut to make space for the baby to come through. And we got forceful pulling on baby's spine and head, whether it's a vacuum, forceps, or even if you look at, and you can search this if you have, search it on YouTube, just a C-section birth. You know, they are cutting through the abdominal wall, cutting through the uterus to get to baby. And they are, what are they grabbing? They're grabbing baby's head, and they are pulling and yanking to get baby out. And so again, when you go out, exit the body through the abdomen, you're missing out on a lot of components that happen naturally. Not to mention, you know, how well mom is able to just connect with baby because she's just had major abdominal surgery, right? So this could, when you have these interventions that take place, could cause a head tilt off to one side, or worse, a posterior position. Posterior is this way. There's no room for the head to move down. And typically we're concerned about a breech position. Breech is where it's going bottom, baby's coming out bottom first as opposed to head first. And there's many different types of positions if you actually look into it, but we want the baby facing down, and the baby will descend, and it's natural. I mean, the baby just knows there's an intelligence in life. And what's really cool is that there's this like natural clock that's taking place. And as it gets closer to labor and birth, that clock speeds up. And as soon as it comes to boom, that's where life knows now's the time. And so if we're going in, and I mean, I think it's pretty common practice to actually encourage women early, not, you know, before 40 weeks, to induce labor. That's where they're starting the labor early. And so they're just bypassing the intelligence of life that says, hey, we're not ready, right? Really, the due date is a guess date, right? We're really guessing on when we think, you know, baby should be in there. Typical first pregnancies, moms go 42 weeks. I mean, they're going past. And again, you want to make sure you've got a good birth team who's really managing and supporting you and understanding the signs and symptoms, right? So I just think that we're just bringing a lens that's not typically heard, right? We're told, oh, a lot of women these days aren't going 40 weeks, we're inducing. And these are all the measures that we take if birth isn't progressing as we would expect. So already we're choosing to induce early, right? So we're bypassing, you know, the intelligence of life that's saying, oh, we're not ready yet. We're not ready yet. Now we have to start introducing Pitocin or other measures to get that baby out. Baby wasn't ready to begin with, right? And again, there are high risks. There are scenarios where it's appropriate. That's not the conversation we're having right now. We're talking about normal, healthy birth process, right? So commonly reported reasons for dystocia: abnormal birth, inhibited nerve function. Let's sit with that one for a second, because what happens in a chiropractic adjustment, right? We're removing stress to the nervous system to support better brain-body signaling. Okay, boom, chiropractic, check. We support that one. Pelvic imbalance. What did we just talk about for the last 20 minutes, right? How does the pelvis move? How is it aligned, right? And if you're already starting with a stressed, structural, and imbalanced state, it's just going to be exacerbated when you introduce a living being who's going to be growing and needs to exit out. And so pelvic imbalance, of course, it makes sense. If you have a lot of torque in your pelvis, that's going to hinder the baby's ability to get around and through and take on a healthy posture and get out, right? And it's going to be really uncomfortable and painful probably throughout your pregnancy. I mean, it's already uncomfortable, right? So if you have the best balance and the best structure, it's already uncomfortable carrying, you know, more weight and abnormal stress out, you know, into your abdomen, right? And then the third commonly reported reason for dystocia, abnormal labor and birth, is baby's position. And again, the baby will alter their position based on the space they have available. Now, that's where so check, right? There's a lot of OBs who understand and know what chiropractic does during pregnancy. They refer out to chiropractors. If they are in the know, if they understand what chiropractors do, they are referring. And they should be. And if they aren't, then we need to make sure we introduce the importance of this. So baby's position, which again is dependent upon the balance of the pelvis. So here's what chiropractic studies show. Restores nerve function to uterus, pelvic balance of pelvic muscles and ligaments. It can lead to a safer and easier delivery, and it strengthens the ability to overcome nervous system stressors. So let's look at this picture here. A 7-year study showed that patients whose primary physician was a chiropractor experienced the following results: 60% less hospital admissions. That's great. 59% less days in a hospital. So that means the less complications, we can release mom and baby earlier. 62% less outpatient surgeries. Okay, so that may be, you know, not having C-sections, maybe not having the episiotomies. You know, I think less surgeries are great. 85% less in pharmaceutical costs. So these, you know, patients aren't requiring pharmaceuticals, which is not introducing a chemical component that can cause stress to the mom and baby and potentially having lasting impacts on the baby, right? So, I mean, if pregnant ladies understood what's happening with their bodies and understood how chiropractic on the front end could minimize the costs on the back end and support recovery, then it's a no-brainer, right? Every pregnant woman should have a chiropractor, period. So let's see, what do we got here? So chiropractic is known for a very specific technique called Webster technique. And there is nowhere else you can have the Webster technique performed or done. It is a chiropractic technique. And the goal is to first analyze and assess the pelvic orientation and pelvic balance. And when we introduce or utilize the Webster technique, the goal is specifically to bring balance to the structure and the system and how it moves in space by addressing the ligaments and tendons and the soft tissue component too. When you receive a Webster adjustment or the Webster technique is applied, it helps support the biomechanical function and supports nervous system function. I mean, that's with every adjustment. Now, we can use a Webster technique on anybody. In fact, I've done it on anybody. You don't need to be pregnant for it. It's beneficial. But when you're talking about this type of stress and strain in your pelvis, like pregnancy, it is vital that this is done. And so as soon as somebody tells me they are pregnant, I am assessing them with Webster technique. That is the primary assessment I use, whether they're 6 weeks pregnant or they are 42 weeks pregnant. That is what we are utilizing. And there have been times where chiropractors have been called in during labor to help support mama, whether it's to help support their nervous system and downregulate, or just the balance of their pelvis and structure to support that baby moving through that canal. So this can be utilized anytime, pregnant or not, but anytime during pregnancy, even into labor. So that is, I think, a vital component to your healthcare when it comes to pregnancy, is to support all those things that we have already discussed. So, and you have to be certified to do Webster. And the International Chiropractic Pediatric Association has been teaching chiropractors for, I think, since the 70s. I'd have to look at the date on this. I think around the 70s, Dr. Larry Webster, I guess, utilized and came up with this technique. So it's been around for some time. But you need to be certified to do this technique. And between both Dr. Kristen and I are certified. Between us, we have 25 plus years of experience. Both of us have, have children. Chiropractic has been a part of my healthcare since I was born. I didn't have a choice. I was born into it. But certainly it was, while I was pregnant, it was very specific care that I received to support my best experience during pregnancy and labor. And so it was interesting. So I had a midwife and I gave birth at home, and my birth, it was fast and furious. And they thought that Margot was going to be born around 6 a.m. She actually was born around 8:30, so 2.5 hours more. And it turned out that Margot's cord was actually shortened, didn't have the length. So every time she went to rotate through and go through my pelvis, she wasn't able, it rebounded. She was pulled back in because the cord was too short. Mm-hmm. And so at one point, my midwife said to my husband, Steve, you go get your phone, you type 911 in, you put it right by the bedside table. We may need to call somebody for this. I think she said that for me to hear, because I was like, we're not doing that. I mean, I pushed through it. But what happened is Margot rotated as well as she could, and then she came straight out this way. And so she came out what's called asynclitic, which is she had a cone shape through her head because she wasn't able to rotate all the way through. And the midwife had just made a comment saying, if you were at the hospital and you had a hospital birth, there no doubt would have been interventions, and those interventions would have certainly impacted, the start of Margot's trajectory in life. And again, there are times where, you can have a home birth. It can be, everything is beautifully laid out and it happens as it should. And you can have a home birth and, you have to make an emergency to, route to the hospital, right? Those happen. But I would say women were designed to give birth. We've been doing it since we existed. And the vast majority of those women have been doing it naturally. Birth has really changed. It's very different than what it was. It's really become, birth is not a condition. It is a normal part of life. But we've created it to be a condition. We have to monitor, and we have to, is anything wrong? And here's the interventions that we take if XYZ is showing up. And yes, there are high risk scenarios, but unfortunately, I think, how many of our doctors who are in labor and delivery have seen a natural birth, have delivered a natural birth, right? And so if you've not seen it, you're not comfortable with it, you haven't done it, then, you're going to be looking for the signs that say, oh, we're not gonna push through this. We're gonna make some interventions because I'm concerned, right? So you really, I think, the important thing about having a chiropractor as a part of your birth team is you just get a different lens. You're hearing something else. And ultimately, we're sharing this because, yes, we want you to have a healthy pregnancy and the best birth experience you can. But we are thinking about what does it look like in terms of mom recovering, but also baby being on the best trajectory of life at the start of life. So if you have questions, please bring them. We've got lots of resources to support mom and baby, no matter where, and how old they are. But it is something we are definitely passionate about because we want our community to be healthier now and 50 years from now than, where we are. And right now, the birthing health in the US is really not great. It's very poor when you compare it to the rest of the world. And not only that, but our children are more diseased and less healthy than their parents were at the same age, right? So we're not on the right trajectory. So we got to start doing something different to get a different outcome. And so this is where I'm going to end. There's a lot of pregnant ladies out there. Do all of them have a chiropractor who's assessed them or is on their birth team? If they are pregnant, they absolutely need to go to a chiropractor, period. So if you know anybody who is pregnant or anybody who's wanting to get pregnant at some point, to start now, right? If you're coming into pregnancy with more balance, that means you are already heads and shoulders above somebody who's coming into pregnancy with more stress, right? So that's my ask of you. Who do you know that would do well with having an assessment by a chiropractor to support a more integrated birth team? So love and appreciate you. Thank you for being here tonight. And we will see you next week for our great topic. So Dr. Miaken Ziegler of Monarch Family Chiropractic.